Good afternoon. My name is Dr. Hillel Mazansky, and I specialize in medical hypnotherapy, guided visualization or guided meditation as it's called, nutrition, and exercise, my mantra being, the mind causes all one's physical and psychological illnesses and ailments. If the mind causes it, the mind helps treat or heal it using medical hypnosis, guided imagery, nutrition, and exercise. Today will be the final in the series of interesting cases that we had in the past year or so. I think this will be number 7, and I'm ending with the most dramatic case of a cure, in parentheses or inverted commas as we say, of a patient with a stage 4 cancer of the prostate. You will hear later on in the discussion what the stage 4 is, but suffice it to say that Mr. M.L., a 64-year-old male living in Florida, was referred to me by his daughter, who underwent treatment telephonically. She improved, and when her father, was given this dire diagnosis of stage 4 prostate cancer, she thought she would call me. Cancer of the prostate, as is in many types of cancers, is divided into various stages. 1 through 4 usually, or sometimes 1 through 5. In the case of prostate cancer, stage 1, when it's limited to the prostate itself, and then when it spreads locally or infiltrates, etc., when there are far distant metastases, and prostate cancer classically metastasizes to the bone, that is called a stage 4 cancer. And why we say there is a cure, we and together with the help of his family, helped in the curing of his prostate cancer. We know that there is a test called a PSA, prostate specific antigen, and that test for prostate of the cancer as a female pap test for cancer of the cervix. When the diagnosis was made, the normal value of a PSA is usually 4 or less. In older people, however, it can go to a level of 10, and it's still considered normal. But over 10, it is abnormal. When he called me, he hadn't had his PSA done for quite some time, and it was 70 at that stage. Why didn't he go for the usual treatment of surgery, radiation, chemotherapy, and other types of medication that we use? Because he refused to go and have allopathic treatment, in other words, treatment by a regular doctor. He was totally holistic, and although the diagnosis was made at a fine hospital in Florida, he refused to have any medical treatment. When we saw him a few months after he was last seen by his doctor, listen carefully, his PSA went up to over 400. I'm not surprised because it spread to the bone, and he had x-rays and PET scans, a special highly specific test, positive emitron test for cancer, and it showed that he had it in both upper arms. As usual, he was given a very powerful antioxidant nutritional diet. He'd never exercised in his life before. He was instructed to begin exercising He was given certain supplements, amongst which, having cancer so diffuse, he had a very low vitamin D level, even although he lived in Florida, because he never went into the sun. We put him onto 10,000 units of vitamin D and other herbs and spices to take. He was given intensive, very deep hypnotherapy sessions, and because it was crucial that he has more than one treatment, we gave him a few treatments, all of which were beneficial. We followed him up, and as time went on, he improved. Unfortunately, after about 6 months, he was lost to us. He'd never called back, and we tried to get him a few times, but the phone was busy or whatever it was, or they were on vacation, I don't know. Eventually, after trying a few times, because I was adamant to find out what happened to my patient, after 9 months or 10 months, I was able to call them back, and they told me that a week before I called, they had his PSA, or prostate specific antigen, done. The level of the PSA was 10. He was eating well, gaining weight, and exercising. Unfortunately, for whatever reason, we lost contact again. And just before going on the air, I called them to give you all an update, and unfortunately, again, they were not available. I know for a fact that had something gone wrong, or had he passed away, his daughter would have informed me, because she still emails me occasionally to give me an update, but I haven't heard from her some time. I did connect with her on Facebook the other day, and I asked how her father was, and she said she was in a hurry and she would let me know. But that is the most dramatic case that I have had the privilege to treat with regard to any type of cancer, because most cancer patients, I empower them to assist themselves in their own treatment using, as I say, the 4 modalities that I mentioned at the beginning. They empower themselves to help heal and treat themselves, because especially a cancer patient, they're going to their primary care doctor, the surgeon, the oncologist, the radiotherapist, the radio-oncologist, and the list goes on and on. And that's why, how is it that a patient can't assist themselves in their own treatment? Now, besides medical hypnosis, guided imagery, nutrition, and exercise, there are a great deal of other things that patients can do to help heal or treat themselves. Time does not permit me, because my next patient is due in 10 minutes, and I just wanted to bring you up to date on this, the most dramatic case I've seen in nearly 3 years of self-healing, if you will, of stage 4 prostate cancer. And I'll end by saying that everything comes from the mind. Although some people are a little bit skeptical, the mind causes all our ailments, and if the mind causes it, the mind helps heal and treat it. There were certain stresses in his life, but I never was able to really get through to the main stress why he developed his prostate cancer. Because on telephonic consultations, it's not the same as when the patient sits in our office. For you all out there, we do not do telephonic consultations anymore, because everything, unless there's an exceptional case that you have yourself, which is not covered by our 25 hypnosis videos at drmedicalhypnosis.com, drmedicalhypnosis.com. You will find 25 different hypnotic sessions, and the cancer is exactly the same as we do here. And we have developed a program now that if you purchase one of our videos, you will receive a 15-minute consultation, complimentary, weekly, until you have improved. Now, we have signed up for a free long-distance calling situation, so if you feel you'd rather have me call you instead of vice versa, my email address is drhm@GIANIMC. Dr. HM stands for my name, Dr. Hillel Mazansky, at G, guided, I, imagery, A, apple, N, Nancy, I, apple, N, Nancy, C, Charlie.com, gianink.com. It's not only for the consultation, but if you wish to ask me any type of medical question, I take only medical questions, you can email me at that address. My name is Dr. Hillel Mazansky, and I thank you very much for listening to all 7 of our health tips. Not our health tips, our case presentations. And tomorrow we'll return to regular broadcasting. Thank you very much.